Well, good afternoon, everyone. My name is Mark Skidmore. I'm the director of the North Central Regional Center for Rural Development, and we're hosting this series of webinars on opioid programming that is being used in different states around, by extension, in different states around the country. I'm also serving as a coordinator for the Extension Opioid Crisis Response Work Group. And our goal in providing these webinars is to help extension around the country match potential programs that they might want to adopt in their own state. So we have a series. Last week we had community-based opioid awareness program presented by Courtney Cuthbertson here at Michigan State University. Just an hour ago we had Lindsay Hughes talking about the life skills training program, and now we have Professor Chelsea Pinckney from the Ohio State University. She's a professor at the pharmacy practice and science, and so she's going to be talking about Generation RX and prescription medication use and misuse. So we're going to start that in just a moment. In addition to the webinar series, we will have all of the recordings and additional information, and that is available on the webinar link that's provided at the bottom of this page here. In addition to that, we're asking people who view the webinars to complete this brief survey. I'm going to put this survey back out there near the end of the webinar. And what this does is not necessarily an evaluation of the presentation itself, but the content and its potential usefulness, so that different extensions can try to find a good match for what's happening in their state and their capacity, etc. So I'll put that out in just a couple of minutes. And so with that, Chelsea, I'd like to pass it over to you. Thank you for taking time to prepare the webinar. Thanks to the participants for joining us. And one last thing, if you do have a question, you can type in your comment or question in the chat session, and Chelsea can take those questions as they come or at the end. So with that, I'll pass it on to Chelsea.
Thanks, Mark. As Mark said, I am a professor at the College of Pharmacy here at Ohio State, and I actually have also a 40% co-appointment through OSU Extension. So everything I do really kind of balances working with the College of Pharmacy and then also with Extension here at Ohio State. So I'm going to share today a little bit about Generation RX, which is a set of tools and resources for safe medication practices for life. So as many of you know, we are a Generation RX. There are over 4 billion prescriptions filled in retail United States pharmacies per year, and pharmaceutical populism is that growing culture of basically self-diagnosis and self-prescribing, using old medications that we may have gotten from a previous diagnosis, looking up our symptoms on websites, and those pieces that are outlined in probably much of the work and that you are able to see that you do, and then also in things like books and websites and other information. So won't touch too far on that, but with regards to the opioid crisis, nearly half of overdose deaths involve a prescription opioid. In some places, because of the laws that have been put into place, that is decreasing, but the number of opioid-related overdoses is then involving street drugs. So this is a picture of OxyContin, which is a prescription medication that we have readily available in most pharmacies. And this is heroin. So as you can see, the two structures, not to get too in the weeds of chemistry, it's not everybody's favorite class, but you can tell where there are similarities and really very few differences. So our bodies really utilize heroin and OxyContin in many of the same ways. OxyContin is a great pain medication when it is used appropriately, but it can also trigger a lot of the same things that heroin can with regards to abuse and addiction. So people who are addicted to prescription opioid painkillers are 40 times more likely to be addicted to heroin, which is where we have seen much of our opioid crisis grow from. The vast majority of heroin users, it's estimated between 70 and 80%, started by first misusing an opioid pain medication. We've also seen that heroin dependence went down when prescription opioids really had a major uptick in the 90s and early 2000s. So the Generation RX initiative itself was started in 2007 at the Ohio State University College of Pharmacy, and it is now a national movement. Our mission is to educate people of all age groups about the potential dangers of misusing prescription medication, and Generation RX itself really is about safe medication use and misuse avoidance covering all medications. So in and of itself, it doesn't necessarily have to be opioid specific. When we talk about the tools and resources, we'll touch a little bit more on that. It does lend itself well to the opioid crisis, but knowing that in the future there might be other issues related to prescription medications, it really serves as tools and resources for how to use all of your medications safely. So generationrx.org is our website where all of our tools and resources are available free and open source for your use. You could go ahead and download all the resources even while I'm talking on this webinar, but as soon as this webinar ends, so they are free and easy to use and all available online. The resources themselves include educational toolkits as well as digital activities in the Take Action tab, which is in the top right of generationrx.org. And we have a toolkit for all age groups in a few different scenarios. So you can see we have youth, so the K through 12, with including high school. We then also have college or university toolkits. We have for adults, and then for older adults, we have specific toolkits, as well as those for patients, and then those in the workplace. So I'm going to highlight a couple of tools and resources available specifically for the youth, teen, and adult toolkits, but you can also take a look at some of the other resources available for the other groups at the website. So if you need to talk to adults in the general public, we have a toolkit for that. And the educational resources that are included with the adult toolkit include a facilitator guide. So you really don't have to do much preparation work besides making yourself familiar with the resources that are available. The facilitator guide will help you to do that. There's also an introductory letter discussing what the program is and its intended purpose. A question and answer session guide so that anybody can facilitate these sessions. You don't necessarily have to be a pharmacist. You could just be somebody working in your community. And I'll talk a little bit later about what we've done at OSU, working through the College of Pharmacy and Extension with regards to some specific initiatives. But there's also a PowerPoint presentation with facilitator talking points, and then a take action handout. So really kind of a summary sheet that lets people know what they were meant to get from the presentation itself. This is what some of the resources look like. They're kind of small on the screen, so I apologize. But the take action kit, as well as the question and answer session guide, have particular information about drug disposal, not using somebody else's medication in the 3 scenarios that are considered prescription drug misuse, so taking it not as directed, sharing, or taking it with other inappropriate substances. And these materials are replicated for kind of age appropriateness and context appropriateness in each of the different kits. So if you need to talk to youth, the Generation RX Teen Toolkit, again, includes the facilitator guide. And then also with the youth tools, youth and teen tools, there are standalone activities. So depending on what other curriculums are being utilized in schools or in other youth activities, these resources and tools can be used in conjunction with those curriculums for a different amount of time allotment. So if you have an hour, you may use the PowerPoint as well as a couple of the activities. If you only have 10 to 15 minutes, you may do an introduction and do a couple of the activities and then end with some questions. So they're meant to be flexible and meant to be accommodating for whatever time or group that you're speaking to. It also has a tips and advice handout, which is really helpful for teens. And the activities themselves are built to be interactive with the teens, and they really, really enjoy them from the times that I've gone out to do Generation RX and some of the feedback that we've gotten from others who have utilized the teen toolkit. Again, this is some of the things that we kind of utilize to make sure that we're engaging the age group, and that we're utilizing the correct types of scenarios when we talk to them about opioids. So not utilizing things like scare tactics, but really utilizing education, and familiarizing them with things that they may know, and then be able to correlate to how they would not misuse medication. So, for example, on the left, some items, this is the big hit, that are not meant to be shared include your toothbrush, your underwear, and prescription medication. We find out usually during this that there are some chuckles in the class, and occasionally we find out that people are sharing some of those items. Underwear usually gets the biggest laugh, but it's one of those things that really tries to engage the students and the learners, and makes them that makes them kind of open and more willing to talk about those types of things. So, from the elementary toolkit standpoint, again, there's a facilitator guide. There's teaching activities that include activity workstation or activity stations, games, and worksheets that students can complete on their own, and also with the help of either their classmates or with teachers and other adults. Also important, there are supportive handouts already pre-crafted available on the website for letters to parents, so that they know what is being discussed in school, and that the parents can go, gives information about Generation RX and the website, so that they know exactly what their kids are learning, as well as some visual aids for the young ones. So this is an example of what do those look like. So we play games like Good Choice, Bad Choice, which makes it very simple and gives the students a really good opportunity to participate and have some discussion. We talk to them about what the prescription label looks like, what features are on there, who are some trusted adults who can help you take your medicines, that you should not take medicines on your own or in a way that you've not been instructed to. And then some of the digital resources that kids can play with, or that they can utilize with a parent or an adult, are things like the Medication Safety Sleuth. So this is a digital resource that has a typical looking medicine cabinet, and kids can go in and touch one of the medications and kind of look at the different features of the label and those kinds of pieces. And then Candy or Medicine. This is another game that youth really like to play, as we have pictures of things that are candy or medicine, and is remarkable about how common these things can look, and also how much they can look alike. So kids will guess which one is candy and which one is medicine, and then they will be told, you are correct, or actually this one is the opposite of what you thought. The Generation RX resources, like I said, are free and easy to use. They have some flexibility for if you're giving this presentation in your area, that you can put that branding on there and put what the specific event is. You can put who you are and what organization you come from. They are research-based. And some of the outcomes that we've seen are, we do post-program evaluations that for intended behavior change. So 94% of teens agreed that they would not utilize prescription drugs not prescribed for them. That adults will only use as prescribed by a healthcare professional, and for seniors, that they'll store medications in a secure location to keep themselves and those around them safe. So some new developments, the Generation RX Learning Collaborative will bring together community pharmacists, and it's a pilot right now. So we're bringing together local OSU extension folks, K through 12 educators here in Ohio, and community pharmacists from Kroger, to be able to interact, request different speakers, have resources available that they can kind of discuss and utilize together on a learning collaborative. We're anticipating that that'll be out this summer. So we also had pilot grants through OSU's Connect and Collaborate grant program that we partnered directly with Extension. So there were 11 counties who were chosen in Southeast and throughout Ohio for opioid misuse prevention projects. This was a partnership among the College of Pharmacy, Extension, university-wide outreach and engagement, Kroger Pharmacy, as well as the Cardinal Health Foundation. And so OSU Extension partners really served as the community experts, knowing what the problems were in their areas and what types of learning and resources their schools and teachers needed. So we had a House bill here in Ohio that required opioid education in the K through 12 schools. So extension workers throughout these counties in Ohio partnered with K through 12 schools and utilized their connections there to work together to bring them the Generation RX resources. We at the College of Pharmacy did a train the trainer model with OSU Extension, and then extension folks were able to train each other then on the Generation RX tools and resources, and also provide some information about what worked well for them and what may have not worked so well, and what kinds of tools they use to improve their own presentations. So these pilots were really successful. There were over 400 adults reached with the Generation RX tools and resources. So parents, school administrators, 4-H administrators, and those kinds of pieces, as well as other members of the community. And then there were over 2,000 youth who participated in Generation RX activities as well. So it was a really great initial pilot, and what we saw work really well in some different instances were, one, the connections that Extension had in the community were vital to being able to get into the schools and make sure that we were able to do it in a pretty short amount of time. The Connect and Collaborate grants are over the course of a year. And also that there were the connections between community pharmacists and extension professionals in different communities that would then have the Generation RX presentations ongoing with the schools, and they would bring in pharmacists from their local community to talk about and co-facilitate the Generation RX presentations themselves. So that was a really successful pilot program, and we're hoping to expand that here in Ohio, and then also to support Generation RX growth in any way that we can in Greater Extension. With that, I will take any questions. Let's see. I also love that the item's not meant to be shared piece. It gets some pretty great responses. Kids will say the darndest things, and that is very, very true. And Candy versus Medicine is really fun too.
Well, one question I have while we're waiting for, looks like a couple of people are typing. It looked like you had a kind of a post-test. Did you also have a pre-test? Or was it more just at the end?
No, we just utilized the post-test.
Okay.
Well, oh, thank you, Christine. Shara, will the toolkit be available for use in our counties? Yes. So the toolkits and the resources are all available online, free to download and print on generationrx.org.
One other question on the evaluation side. My impression is that you do have some great evaluation, but it's not necessarily evidence-based or according to the sort of government standard. Is that true?
And that is something that we are constantly improving, both our toolkits and resources, and then also something that we are working on is the evaluation of these different tools and resources, and also to know where they're being used, and some feedback from those different places. So that is, stay tuned. Those are being developed and implemented in kind of an ongoing process.
Oh, I really appreciate having all of this available right on your website. That's really great too. I'm wondering if there are any other chat questions coming through. I see one. Erica is typing something. I remember growing up, we had a guest, one of my brother's friends stayed with us for a while, and every once in a while my toothbrush would be wet, and I'd say, that's funny. I didn't brush my teeth. As it turned out, he didn't make too much of a distinction about whose toothbrush he was using.
Yeah, so. And kids will really turn on their parents and say, my mom washed my sister's underwear and made me wear it, but because mine was missing. So you find out a lot of really interesting family dynamics too. They're all washed though when they come from parents, I think. So in their
Yeah.
defense.
Well, I see Kashara is typing something. We'll wait for a moment and see.
That is a great question, Kashara. Will there be an opportunity for other extensions to be a part of the next grant cycle? We have had some different grants go in to some different granting organizations utilizing Generation RX as a tool or resource in their planning model. So we at Ohio State just submitted a grant. I'm pharmacist, and we submitted it to the maybe well, Laura was on. Maybe she could help me with the granting organization. It's the National Institutes for Farming and Agriculture. I'm probably going to be wrong on that, but I've seen grants solicited that way. At this point, Connect and Collaborate is an internal grant cycle. However, it would be something to consider for moving forward. Cardinal Health Foundation does put out their own Generation RX grants, which are available in other places outside for extension programs outside of Ohio State as well. So the Cardinal Health Foundation would be the first place that I would look for those.
For all of the participants, you'll see the link right there to the evaluation tool. And again, this is not an evaluation of the presentation per se, but just trying to help people within extension across the states try to find resources that are a good match for them and their state. So we really appreciate you completing that survey. It just takes a couple, just literally 2 or 3 minutes, I think. So I don't see any other questions. Chelsea, do you have any other thoughts before we close off?
No, if anybody is interested, my contact information is there, and I'm happy to answer any other questions you may have or provide any additional feedback or information if you'd like to contact me.
Okay, well, great. Thank you again, Chelsea, for taking time to pull this together for us, and thanks to the participants for joining us, and thank you as well for completing the evaluation. And with that, we'll sign off for today. Remember, we do have 2 more webinars tomorrow at 1 p.m. and 2 p.m. The first is on mental health first aid, and the second is on the community assessment to promote behavioral health planning and evaluation. And then we have 1 more on Friday of this week. So a busy week of webinars. And then the one on Friday is about the Strengthening Families program. And then we have 1 more on Prosper, but a date has not yet been set for that. And we'll let you know about that as soon as we hear. Okay, with that, we'll sign off. Thanks again.